Imagine a world where we could take a simple test to find the perfect psychiatric medication for us, with no side effects or trial and error. Sounds too good to be true, right? Well, that's exactly what psychopharmacogenetic testing claims to do. But is it really the miracle solution it's made out to be? Or is there more to the story? Psychopharmacogenetic testing, or PGX testing for short, is a hot topic in mental health treatment right now. It combines pharmacology and genomics to try to understand how our unique genetics influence the way we respond to different medications. The goal is to use this information to personalize medication plans and reduce that frustrating trial and error process of finding a medication that works for you. But here's the million-dollar question. Are these genetic tests actually helpful in personalizing medication plans, or is it all just a bunch of hype and maybe even a fraud? And who am I to answer this question? My name is Dr. Sulman Aziz Mirza, triple board certified in adult psychiatry, child and adolescent psychiatry, and addiction medicine. And before you accuse me of this being an ad for these companies, just know that while I offer gene side of my practice, they ain't paid me shit. So, what exactly is psychopharmacogenetic testing, or PGX for short? In a nutshell, it's a way of looking at how our unique genetic makeup might affect the way we respond to different medications. PGX combines two fields of study: pharmacology, which is all about how drugs work in the body, and genomics, which looks at our genetic code. Here's how it works. A DNA sample is collected, usually through a quick saliva swab or blood draw. This sample is then analyzed in a lab to identify specific genetic variations that could impact how well a medication works for an individual, or if they might be more likely to experience certain side effects. The goal of PGX is to take some of the guesswork out of finding the right psychiatric medication. Instead of the commonly seen trial and error approach, where a person tries different meds to see what sticks and, more importantly, what doesn't, PGX aims to use genetic insights to guide medication choices from the start. By understanding how a person's body might process or respond to a different medication, the hope is that doctors can make more informed decisions and find effective treatments faster. It's important to note that PGX testing does not give a definitive answer on the perfect medication for someone. Genetics are just one piece of the puzzle. Factors like symptoms, past treatment experiences, and overall health still play a crucial role. But PGX can provide valuable information to help steer the decision-making process. So, in theory, PGX testing sounds like a game changer for mental health treatment. A simple test that could point you towards the best medication options and spare you from nasty side effects? Sign me up. But before we get too carried away, it's worth taking a closer look at what the experts have to say. As it turns out, not everyone is sold on the promise of PGX testing. Some major organizations in the field have pumped the brakes on fully endorsing these tests. So what's the holdup? While the potential of psychopharmacogenetic testing is exciting, major organizations in the field have pumped the brakes on fully endorsing these tests. The American Academy of Child and Adolescent Psychiatry, AACAP, and the Food and Drug Administration, FDA, have expressed caution against the widespread clinical use of pharmacogenomic testing for psychiatric medications. In October 2018, the FDA issued a safety communication warning against the use of genetic tests with unapproved claims to predict medication response. They highlighted that changing a patient's medication regimen based on these test results can lead to, quote, inappropriate treatment decisions and potentially serious health consequences for the patient, end quote. One of the main reasons for their hesitation is the limited evidence supporting the efficacy of PGX testing. Only a small fraction of commercially available pharmacogenomic tests have undergone randomized controlled trials, and those that have typically involve adults rather than children or adolescents. The FDA notes that despite the availability of tests, the relationship between DNA variations and the effectiveness of antidepressant medication has not been established, and this can lead to healthcare providers making inappropriate changes to a patient's medication based on unsupported claims. AACAP recommends against using pharmacogenomic testing as a primary tool for making treatment decisions due to the limited evidence supporting its efficacy. Factors such as slow and thoughtful medication management, concurrent use of multiple medications, and genetic variation affecting medication response complicate the use of pharmacogenomic testing. These factors are often not accounted for adequately by the tests. So while PGX testing sounds like a promising tool for personalizing psychiatric medication plans, The reality is that the evidence supporting its widespread use is still limited. Major organizations are urging caution and advising against relying solely on these tests for crucial treatment decisions. But hold on, that doesn't mean PGX testing is a total bust. There are definitely certain situations where it can provide valuable insights to guide medication choices. And some specific genes have been identified as clinically actionable in psychiatry. So, can these tests still be beneficial despite standing on shaky evidence? Alright, so PGX testing isn't a one-size-fits-all solution, but that doesn't mean it's never useful. In fact, there are certain situations where genetic insights can be incredibly valuable in guiding medication choices. For individuals who have had poor responses or nasty side effects from psychiatric meds in the past, PGX testing can be a real game changer. By looking at specific genes that affect how the body processes these drugs, doctors can get a clear picture of what might work best for a particular patient. Expert consensus has identified 4 genes that are especially important in psychiatry: CYP2D6, CYP2C19, HLA-B1502, and HLA-A3101. These genes play a key role in how the body breaks down many common psychiatric medications. Variations in 2D6 and 2C19 can impact how quickly or slowly a med is metabolized, which can affect its effectiveness and the risk of side effects. And when it comes to HLA-B1502 and HLA-A3101, these genes are linked to some pretty serious adverse reactions. Certain medications, like carbamazepine, Tegretol, or oxcarbazepine, Trileptal, can cause life-threatening conditions like Stevens-Johnson syndrome in people with specific variants of these genes. Testing for these alleles before prescribing may help prevent potentially dangerous outcomes. So, while PGX testing shouldn't be the only factor in treatment decisions, it can provide valuable information to guide the process. By understanding a patient's genetic profile, doctors can tailor medication choices to minimize the risk of adverse reactions and improve the chances of finding an effective treatment. But as promising as this all sounds, it's important to remember that PGX testing isn't perfect. There are some potential downsides and risks to consider before jumping on the bandwagon. What might those be, you ask? Let's just say that relying too heavily on tests that include genes without strong evidence could lead down a dangerous path. Sure, genetic testing for medication response sounds great in theory, but let's take a step back and consider the potential downsides. One major risk is relying too heavily on tests that include genes without strong evidence to support clinical decisions. Many companies market pharmacogenomic panels that claim to guide medication choices, but these tests often go beyond the handful of genes that are actually considered clinically actionable. When healthcare providers make changes to a patient's treatment plan based on unsupported genetic test results, it can lead to inappropriate and even harmful medication decisions. The FDA has warned that this could put patients at risk for serious health consequences. Imagine having your meds switched up based on a test result, only to find out later that there wasn't enough scientific backing for that decision. It's not a good situation to be in. Another issue with pharmacogenomic testing is that it doesn't account for all the complex factors that influence medication response. Genetics are just one piece of the puzzle. Things like age, other health conditions, and environmental factors also play a role. Relying solely on genetic tests to guide treatment ignores these important considerations. There's also a risk of overinterpreting pharmacogenomic test results. Just because a patient has a certain genetic variation doesn't necessarily mean a medication won't work for them, or that they'll definitely experience side effects. These tests provide probabilities, not certainties. Misinterpreting the results could lead to prematurely ruling out potentially effective treatments. It's crucial to remember that pharmacogenomic testing should never replace a comprehensive clinical evaluation. Doctors need to consider a patient's full history, symptoms, and previous treatment experiences when making medication decisions. Genetic test results should just be one tool in the toolbox, not the sole basis for treatment changes. There are also ethical concerns around privacy and informed consent with pharmacogenomic testing. Patients need to fully understand what the test involves, what the test could mean, and how their genetic information will be used and protected. Without proper education and safeguards in place, there's a risk of misuse or unauthorized sharing of sensitive data. One more thing that we cannot overlook is who these tests are being marketed to: primary care physicians and nurse practitioners, the providers who are not the experts in psychiatric medications. While often advertised as a way to quickly make a medication decision by following their red light, green light systems, this can lead to potentially problematic decisions that do not take into account the complexities of psychiatric disorders. Lastly, access and cost remain barriers to widespread adoption of pharmacogenomic testing. Not all patients may have insurance coverage for these tests, and out-of-pocket costs can be substantial. This raises questions about equitable access to personalized medicine approaches. As we look to the future of personalized medicine, it's clear that pharmacogenomic testing has the potential to revolutionize the way we approach psychiatric treatment. But it's crucial to remember that PGX is just one tool in the toolbox. It can provide valuable insights to guide medication decisions, but it should never replace a comprehensive clinical evaluation. I've seen this go wrong so many times that I can remember in my own practice, where a new patient coming from another provider will say to me, "I was doing fine on this medication, but we did the test and it said it was a red light med, so we switched to one of the green light meds, and I did so much worse." The most effective treatment plans will always be those that take into account a patient's full history, symptoms, and unique circumstances. Genetic test results should be considered alongside these other important factors, not used as a standalone solution. As our understanding of these complex interplay between genetics and medication response continues to grow, it's exciting to imagine a world where every patient can receive truly personalized care. We must also proceed with caution, ensuring that we have strong scientific evidence to support any treatment changes based on PGX testing. The key is to strike a balance, leveraging the power of genetic insights while still relying on the expertise and judgment of trained healthcare professionals. By using PGX testing judiciously and in concert with traditional clinical approaches, we can work towards a future where psychiatric treatment is more precise, effective, and tailored to each individual's unique needs. So, what do you think? Is pharmacogenomic testing the key to unlocking personalized medicine, or just one piece of a much larger puzzle? I'd love to hear your thoughts in the comments below. If you found this video interesting, make sure to like and subscribe to the channel, share with your family and friends, and drop your comments as always. If you want to learn some more about some of the potentially dangerous marketing out there, make sure to check out my video on the wild and unregulated world of supplements. Until next time, be safe and be well.